Hello, I am Dr. Brooke Patterson, and I'm here to talk to you about geropharmacology and the use of herbs and supplements. In the United States, persons greater than 65 are prescribed more medications than any other group. When used appropriately, medications can enhance the quality of life and promote healthy aging. However, when used inappropriately, they may contribute to both morbidity and mortality. First, I would like to speak to you a little bit about pharmacokinetics versus pharmacodynamics. Pharmacokinetics is a study of the movement and action of a medication in the body. The concentration of the medication at different times depends on how the medication is absorbed, distributed, metabolized, and excreted. Most medications are administered orally, and many of those lead to a dry mouth and decreased salivation, especially those with anticholinergic effects. Age-related changes in the stomach have several potential effects. There is a decreased amount of gastric acid, which may slow the action of certain medications. Delayed stomach emptying may slow down the effectiveness of short-term medications. Also, slowed intestinal motility is frequently encountered in older patients. Normal changes with aging include lower total body water and higher body fat. Fat-soluble medications may concentrate in adipose tissue to a greater extent than other tissues, causing medications to accumulate. Also, the decrease in body water may lead to higher serum concentrations of water-soluble medications. Age-related changes include a decline in kidney function. This change may lead to potential accumulation and toxicity. Pharmacodynamics refers to the physiologic interactions between a medication and the body. The older a person becomes, the more likely he or she will have altered and unreliable pharmacodynamics. In the older population, there are many different issues in medication use. Polypharmacy is defined as the use of 5 or more medications or the use of multiple medications for the same problem. The two major concerns with polypharmacy are the increased risk for medication interaction and the increased risk for adverse events. The more prescribed medications a person takes, the greater the possibility one or more will interact with another. As the popularity of medicinal herbs and other dietary supplement rises, so does the risk for interactions with prescribed medications. For example, several herbs have an effect on coagulability. When these herbs are taken with warfarin, the risk of bleeding may significantly increase. Many foods interact with medications and may also bind to them, affecting their absorption. For example, calcium in dairy products will bind to levothyroxine, tetracycline, and ciprofloxacin, thereby decreasing their absorption. An example of medication-to-medication interaction may occur when medications intended for oral administration must be crushed, mixed, and dissolved in water to pass through a feeding tube without clogging. Between 2004 and 2008, there was a 52% increase in the number of adverse drug reactions in inpatient settings. More than half of these were related to corticosteroids, anticoagulants, and sedative hypnotics. The Beers criteria is a published list of potentially inappropriate medication for the elderly. When one of those medications on the do not use list is prescribed in the long-term care setting without documentation of an overwhelming benefit of its use, it can be considered a form of medication misuse. Psychoactive medications are those that affect mental function, which in turn affects behavior. Medications with psychoactive properties have a higher than usual risk for adverse events and must be prescribed and administered, especially in the older population, with an acute awareness of how age-related changes in absorption, distribution, excretion, and hepatic function affect their overall concentration. Antipsychotic drugs are tranquilizing medications used primarily to treat psychosis, including those associated with dementias, and are used off-label as mood stabilizers for bipolar disorder. Some of these medications include Thorazine, Haldol, risperidone, and Seroquel. Because of the seriousness and frequency of the side effects, These medications are prescribed at the lowest dose possible, and the patient is monitored closely. Because antipsychotics affect the thermoregulatory pathway, patients taking them cannot tolerate excess environmental heat. Even mild elevations of core temperature can result in liver damage, called neuroleptic malignant syndrome. This disorder is characterized by a high fever, rigidity, and altered mental status. The more commonly seen significant potential side effects of antipsychotics are movement disorders, also referred to as extrapyramidal symptoms. These include acute dystonia, akathisia, Parkinsonian symptoms, and tardive dyskinesia. The nurse is the key person in ensuring that the medication used is appropriate, effective, and as safe as possible. The initial step in ensuring that the medication used is safe and effective is to conduct a comprehensive medication assessment. Patient education is the most common intervention used to promote safe medication use because of the complex needs of the older patient. It is important to identify key persons, minimize distractions, and provide adequate teaching during a time when he or she is most engaged. Appropriate nursing interventions include those that minimize polypharmacy, avoid adverse medication reactions, and promote adherence to medication regimen. The promotion of safe medication use requires attention to the potential for misuse, including overuse, underuse, erratic use, and contraindicated use, all of which are referred to as non-adherence. Misuse by patients may be unintentional, such as with misunderstanding or trying to make a prescription last longer because of cost. Many individuals continue their prescribed medications and therapies in addition to other complementary and alternative herbs and supplements. Currently, the U.S. government has no standards in place to control the quality of herbs or herbal products or other supplements. Nurses and other healthcare professionals should always ask about the use of herbs and supplements when conducting a health interview. There are many types of herbal forms and products, including teas, capsules, tablets, extracts, oils, and tinctures. Some studies indicate that teas have anti-inflammatory and antioxidant properties. Green tea specifically has been associated with a decreased risk of some cancers. Chamomile is usually taken in tea form. It is reportedly useful in GI upset and sleep promotion. However, it is important to note that excessive ingestion of any teas can be dangerous. Echinacea is a very popular product, especially for upper respiratory infections and common colds, and is available in many different forms. Among the reported benefits of garlic are the ability to decrease blood clots and reduce total serum cholesterol and LDLs. Ginkgo biloba is a leaf extract from the oldest living tree species. Many studies, often very small, have investigated ginkgo for many conditions, especially cognitive function and dementia. One of the most serious effects of ginkgo use is bleeding. In small clinical trials, it has been found that ginseng may lower blood glucose levels and improve immune function. Glucosamine and chondroitin are natural substances found in cartilage and connective tissue. They are typically used for osteoarthritis of the knees to help reduce pain and improve function. Hawthorn is a small flowering tree in the rose family. It has been used for centuries for the treatment of heart disease and kidney problems. Hawthorn is considered safe for short-term use up to 16 weeks. However, close oversight by a knowledgeable healthcare provider is recommended due to the potential side effects. Sleep disorders are increasingly common with aging. Melatonin is used as an alternative to sleep medications. Melatonin can decrease sleep onset latency, increase sleep duration, and improve sleep quality. Care should be taken if the patient is taking other medications that can cause drowsiness. Red yeast rice is thought by many to be helpful in controlling one's cholesterol level. The medicinal effect is chemically equivalent and as effective as the lipid-lowering drug lovastatin. However, the side effects are similar, such as myalgias. St. John's wort has historically been used for mental disorders, nerve pain, and many other issues. Although it is used without clear evidential support, it is often used for depression. Saw palmetto has been used for a variety of symptoms, most notably for those related to benign prostatic hyperplasia or BPH. A number of herbs, minerals, and supplements may have positive effects in lowering blood pressure, but they need more research to support their treatment. Some of these include coenzyme Q10, garlic, green tea, hawthorn, melatonin, and magnesium. The number of elderly persons who are living with HIV is increasing. Many have been using a number of complementary therapies to address their symptoms. Elders with disorders such as irritable bowel syndrome are likely to use alternative therapies. Psyllium, a bulk laxative, may decrease irritable bowel syndrome (IBS) symptoms, although results are conflicting. Some of the herbs that need more scientific study for helping patients with cancer include milk thistle and garlic. Drinking green tea is thought to prevent cancer, but evidence is conflicting and insufficient. There is some scientific support for the modest improvement in Alzheimer's and dementia symptoms using ginkgo. It is often used because it increases blood supply to the brain. Fenugreek, when consumed as a cup of tea 3 times a day or taken orally in a capsule, can induce a hypoglycemic response and must be used carefully. It can also cause diarrhea. Cinnamon is another herb that has been linked with lowering blood glucose levels, but scientific evidence is mixed, and overall the results do not support its effectiveness. The nurse can promote healthy aging in several ways among people who are considering the use of herbs and supplements. Including herbs and supplements in the perioperative or emergency surgery assessment is of vital importance. As discussed, hypertension, excessive and prolonged bleeding, and the increased chance for interactions between the herbal and other drugs are possible. If an herb or supplement is being used in an inappropriate way, the goal is to discontinue use or to use only the advised dosage for the specific condition. This can be done by providing education and discussing safer and better ways to use it. If it is unclear whether the herb is beneficial or harmful, it is the healthcare professional's responsibility to determine this information and inform the patient. Important interventions of the nurse in promoting the promotion of healthy aging include checking for side effects, adverse reactions, and interactions among herbs, supplements, and medications.